Greetings everyone, my name is Masi Waini Mutinda. I'm a fourth year physiotherapy student in Maradi University. Today we're going to be discussing about the Cbr Health Matrix. Please stay tuned, let us understand together. So the Cbr Matrix has 5 main components. Number 1, there is health prevention, health promotion, medical care, rehabilitation, and the assistive devices. We're going to go one by one into all these things. So, number 1 is health promotion. What is health promotion? Health promotion is a process of enabling people to increase control over and to improve their health. What do you understand by the definition of health? According to the WHO organization, the definition of health is the state of being mentally, spiritually, socially, and physically well-being, and not just the mere absence of disease, as most of us want to think. In the health promotion sector, we have 5 main domains. Number 1, building healthy policies, public policies. Number 2, we have creation of opportunities with a good environment. Number 3 is strengthening community action. Number 4 is developing personal skills, encouraging people to develop personal skills. And then lastly, we have reorienting health services. By example, maybe if you do research, you're supposed to update the hospital on the various modalities, especially for us physiotherapy students. You can update your OPDs or IPDs with the latest advances in medical care so that you can provide good medical care to your patients. Secondly, we have the health prevention. Health prevention basically has 3 main types of health prevention. Number 1, we have primary prevention. When you're talking about primary prevention, this is the initial stage where you do not have the disease, so we are just trying to prevent the disease from occurring. How do we do this? For example, by giving maybe immunizations, we are giving proper nutrition, we are giving proper sanitation, so this prevents the disease from occurring. Stage 2 of prevention is called secondary prevention. In this case, there are people who are having a high risk factor of developing certain conditions, for example, stroke, for example, spinal cord injuries, for example, cancers. So what we do in this is, if the patient is already discovered they have this condition, we are supposed to try to maintain or decrease the deterioration of the disease. How do we do this? Maybe we can go for cancer checkups if you have maybe mammograms to prevent breast cancers. We can also have eye checkups. We can also have early mobilization if the patient has OA and osteoarthritis, that is. Early detection of these things may help us prevent the further progression of the disease. And then lastly, we have tertiary prevention. This is the last stage where the patient already has the disease, so we are just maintaining and limiting, we are trying to refuse to maintain the reversal of the disease. We don't want it to progress too much, and we also don't want it to have the patient in a position where they cannot perform their own ideals. So that is tertiary prevention of health. Let us continue. So next we have medical care. In medical care, we also have 3 types of medical care. We have primary, secondary, and tertiary care. So in primary care, this is the immediate help. When someone is having a disease in the community, they always first seek help from the medical clinics or the community at large. So this is the primary care. Secondary care, this is the care that is provided in a larger clinic or when you decide to go to the hospital, big hospitals. This is when we term this as secondary care. And tertiary care is the highest amount of care that can be given, which is provided by specialized medical professionals. For example, you go to a neurologist, you go to a cardiologist, and in cooperation with the nurses, they provide health care to this person who is having complications. Then fourth, we have the rehabilitation. Basically, rehabilitation is the whole Cbr team. In this, we ensure that the patient is knowing the disease, the patient is able to do ADLs, the patient is able to access health facilities, the patient is also able to work. It includes all the components of the Cbr matrix. And the main action of rehabilitation in this case will be education, ensuring the patient is able to access the medical facilities. And in case of disabilities, people are supposed to have interventions that they require that are provided to them. Then lastly, we have assistive devices. As we all know, assistive devices can be prescribed, and you can go to the prosthetic and orthotic specialist. But our role here in the Cbr Health Matrix is to, number one, first you educate the patient, you ensure that they have a good quality of life, you and make sure the patient understands that how to use this assistive device that you have provided, and you also allow the patient to know when to use it, because in a society we have different environments. So if the patient is having a bumpy area, or in case of stairs the patient cannot use a wheelchair, so you can give crutches instead, and likewise. So all these are the 5 main domains of the Cbr Health Matrix. I'm going to repeat them. We have health promotion, health prevention, medical care, rehabilitation, and then lastly we have assistive devices. Thank you so much for watching, and I hope this video was of much help to you.